Ja, ich hatte es gerade schon gesagt, unsere nächste Rednerin ist schon in Position und da der Vortrag auf Englisch ist, werde ich auch jetzt ins Englische wechseln. So, data are the new gold, it said, and especially during the time of the pandemic, the Danish Health Data Authority has seen that Jetzt ist da eine Rückkopplung. That by a close monitoring and by gathering relevant data, they are able to efficiently handle the pandemic from, for example, a monitoring and data sharing point of view. So let's listen and learn how a coherent health network handles COVID-19 by means of an advanced cross-sectoral eHealth infrastructure. And please welcome the Director General of the Danish Health Data Authority, Lisbeth Nielsen.
Thank you very much.
Hello. So before we start with your keynote, I would like to have a quick chat with you and ask you some questions because we just had the discussion about the current status of the digital health in Germany. So I would like to know how you see it.
The situation in Germany?
Yes.
I think the Minister of Health was probably right talking a bit about the Berlin airport. At least it's a very different situation from Denmark. I think you have outstanding healthcare in Germany and probably very efficient IT as well. It's very much different from Denmark because one thing is we're a very small country and we have a 25-year-old history of exchanging the patient information digitally, and we have not the least the regulation through Parliament allowing us to actually share data and also patient access in a national health portal. So we have a whole national infrastructure that's digital, and we have the legislation behind it. And I think that's probably one of the things that separates the two countries the most, apart from a totally different hospital structure with very few hospitals in Denmark. We have only 21 acute hospitals in all of Denmark. So it's a different system.
What we're also interested in is how you're handling and coordinating all the responsibilities regarding the digital health in Denmark.
Yes, we have the organization that I'm headed is part of the Ministry of Health and Elderly in Denmark. So I'm the Director General of a national authority where we both work with the digitalization of healthcare and also with the whole monitoring of the healthcare system, so statistics and supplying data for researchers. So there's a both on a state level, there's an entity, and we both we don't do regulation. That's for the Parliament to do, but we do some central services, and then of course all the patient work with patient and all the apps and the health systems that are the IT systems, the EPAs, is bought and used out in the hospitals and in the 5 regions. And there's a lot of cooperation across, which I'll get back to in my presentation. But we have quite a lot of formal cooperation between us. And again, it's a small country, so there are only 5 regions, and they're all part of the same legislation.
Yeah. One more question. In our panel, we were discussing about TV advertisement spots. Do you have something like that in Denmark?
Yes, but that hasn't been in use right now. We do have all of the national health authorities do use social media a lot. And we've had, during the pandemic, also used the public TV stations and radio stations.
Oh, great. So, Mrs. Nielsen, please go ahead with your keynote. I'm very much looking forward to your keynote. Thank you.
Thank you very much. We'll share the presentation, and I hope you can see it. Okay. So, what I'm going to talk a bit about today is how in a country where we actually have both the standardization and the cooperation and the legislation to share health data digitally, how did we handle the whole COVID-19? And we're still working on it, of course, but how did we use that infrastructure, eHealth infrastructure, to work in the pandemic? I will be, sorry, just needed to change the slide. I'll be talking a bit about some of the digital initiatives we have worked with against COVID-19. Of course, one of the first things that happened back in March, we had a big national close down on March 11. was everyone staying at home, both patients and citizens, as well as some of the healthcare providers in hospitals and general practice. So we work with accelerating the distribution of video consultations and the patient-reported outcomes. I'll get a bit into that. Also, it was decided in start April and made out to work in late April that there was a fast and universal access to testing, PCR testing for COVID-19, accessible for all citizens, with a national booking facility and also a testing facility and reporting of the answers. Also, we've been building an app, Smittestop. So Smitte is, I don't know if the same word in German, but it's when you have a contagious disease. So stopping that. And also we're working with the reliable data. And just a few words on the app first. It's built on the new interface that Apple and Google has done, where there's no tracking of the individual. So it's a national app, but as a national authority and in charge of the app, we do not know who has installed the app. We don't know where they go, but they can. But if you're tested positive, you can register that in the database, and people you were close to will get a notice that they were close to someone who has been tested positive. The app is now, and it's been actually also been the most data ethic committees in Denmark has been trying to promote it as well, because it's viewed as using very safe technology. It is now downloaded by there are 1.8 million downloads, and this is in a population around 5.8 million people. And more than 8,400 people have said that it's from a message from the app that they are now seeking testing. Other than that, we have been accelerating the use of video consultations. We have a national video hotspot or distribution net where you can set up video conferences. This is part of the Medcom cooperation, which is a common cooperation between the state and the regions and the municipalities. And as you can see, we had a spike in video meetings, sorry, I was just distracted by a Skype call. These are the days of Skype calls. We've had several hundred thousands video consultations, 340,000 video meetings with at least 2 participants has been performed from March till October, and we've had a huge rise. Right now, we are back to a more normal level, and what we see is that video consultation is going back to being used not that much anymore. Also, what we did in the pandemic was to build it into apps that were used already with with general practitioners and some of the hospitals and regions. It's a general functionality that has been built into the different providers of healthcare to their solutions that they can use that. This has helped, of course, at the period in time where nobody could go to the doctor. The whole testing facility is that we already had the possibility to request a lab examination, so that the general practitioner could send a requisition to the lab, and the patient could go to the lab and have a test performed. What we did when we needed to build national test centers for COVID-19 is that we sort of elaborated on that, and we made there was already a website for people to book times for laboratory testing. We did a copy of that and filled it up with a lot of more machine power, and that was built as a national website where you can go and book testing in the national test centers. There are 16 permanent national test centers, and then there are also a lot of mobile teams that go out and test patients and also the people working in, for example, elderly facilities for the elderly. But as a citizen, If you have no symptoms or you have light symptoms, you can just book. When you're over 2 years of age, you can book an appointment and you can go get tested. And the goal is that you should be able to get tested, if not the same day, then the next day. And we more or less live up to that. If you're a close contact to a COVID positive, you can also, and you're contacted by the National Authority for Patient Safety that track connections to COVID-19 positives. There's a fast track, so you also go and book, and you should be able to get an appointment the same day. All these, and also so all these people go to national test centers. All of those tests are analyzed right to a building right here next to me. One place right now, it's the State Serum Institute, and soon they are building another facility in Jutland. And they started out with being able to handle 5,000 tests a day. And now we're up to, I think, 65. And at the end of the year, they'll be up to being able to analyze 100,000 tests a day. If a person has symptoms or needs medical attention, they can call their general practitioner, and they can either be referred to testing before they see a health professional, or they'll go to a regional assessment clinic, and then they can know if they can assess the patient for other symptoms than just COVID. And those tests are performed at regional test centers. But all these tests that are analyzed, all the results go into the same database, and then the patient can access on the National Health Portal, and also in several apps, they can get to know whether they were tested positive or negative. Also, of course, their doctor, their general practitioner, or the hospital who ordered the test will get the result. And in every positive case, is contacted by the National Authority for Patient Safety. They're the ones taking care of tracking. Just a few, then we also do collect on a national level, because we have all the tests, we do collect all the cases. So these are the numbers for today. They get in every morning and every afternoon at 2 o'clock. We do this, there's a dashboard sent out to the Prime Minister and all of the decision makers. It's also available on the internet. You can see the number of confirmed cases totally. You can see today's number, which is 1,169. You can see the total number of tested persons in Denmark. So these are all individuals that have been tested. So 3.3 million people out of the 5.8 million citizens have now been tested for COVID. You can see that the total number of samples is higher, because we have healthcare professionals and others who have been tested more than once. Also, we collect every day the number of patients admitted to hospitals that are COVID positive or admitted because of COVID symptoms. So today, and we track every day also the increase or decrease in patients. Also, the total deaths. All these data are taken from our national registries, which we run here at the National Health Authority, Data Authority. And today, since yesterday, we have 5 more deaths, but still quite a low number on a national level. We also do track how many are recovered from infection. This is, of course, just only based on time. I'm running out of time, I see. So these are the response times, and we get those every day also to see what are the response times on the tests. The PCR test. So around 31 hours right now for the last 2 weeks is the number of hours for waiting for your test. This is the increase of the testing from late August, but before that it was much lower. So it's a huge rise in capacity, and we've been building quite a lot, putting quite a lot more agents into and servers on that. This is also had a huge significance on our National Health Portal and the infrastructure. So from last year at the same time in September 19, the Health Portal had 3.5 million visits, and a year later it's almost doubled to 6.5 million. We had 2.2 unique visitors September last year. This right now in September 2020 it was 4.4 unique million visitors. And what's really interesting is trying to look up your lab answers. This has been possible for years. And as you see, last year it was 170,000 lookups in the national portal for lab results. And right now in September 2019, it was 6.9 million lookups. And this is also because people are, of course, very much eager to see their results, and sometimes they need to look up more times before their result has arrived. And this is just a big surge in using the national infrastructure, and that's what we're working on ahead of us, is trying to make the infrastructure work with this, and also trying to use the momentum that we have got. Thank you.
Thank you very much for your keynote and all the information you just shared with us. Thank you.